Leeds Children's Hospital, based within Leeds General Infirmary, is the second largest service for children in the UK. It's second in size only to Great Ormond Street Hospital. The service treats children of all ages from across Yorkshire and beyond, including premature babies. Over 200,000 children are treated here in a year. Leeds Children's Hospital Appeal was launched to provide home comforts for patients and their families. It raises funds to create a child and family friendly environment throughout the dedicated Children's Accident and Emergency Department, children's theatres and the wards, clinic areas and parent waiting rooms. The neonatal wards specialise in the care of ill or premature newborn infants. Some are born up to 16 weeks early.
Oliver was born at 24 weeks and 5 days gestation. He's had various complications, chronic lung disease, problems with his airway mainly. He had to have a tracheotomy put in. It's amazing what they can do and how babies can come so far, to be honest. Because he was £1.50 when he was born, so he's so small. I think places need to be made more like lively and not boring, because then it makes you feel a bit more like you're at home. Because we've been through that many operations and that many bad times of going back to intensive care. We spent 13 weeks continuously on a ventilator. And I'd say about 6 months out of the 8 months of being in intensive care, we've never really been out of it, but now we're actually on the last stages of getting home, which is going to be good.
Many state-of-the-art incubators are provided by fundraising. Parents and carers can spend days, weeks and even months here.
So we've been here 8 days now. It's obviously an incredibly stressful thing. We're here constantly, it's intensive. It's very difficult not to just stare at the four walls and just kind of, the monitors and the numbers and everything are, really increase your anxieties and things. So it's really important that we have the environment helps with that. So it would be great if there was any way that we could develop the environment around here and just make it nicer and more comfortable, so that it helps our anxiety, it helps us have something else to look at and focus on. So obviously donations that can help do that and create a nicer environment, even in this environment, would be much appreciated and will make a big difference.
Hi, my name's Katie. I'm the play specialist on Ward 48. My role is to make the children happy and to make sure they have no fears or any anxieties about hospital. If they do, we work through them, doing play programmes and also lots of entertaining and providing lots of games. We do lots of distraction and preparation at hospital as well. Distraction through using lots of books and visual aids to help them concentrate on something other than any pain or any other anxieties they have about a procedure being done. Dressings changed, plasters removed, things like that. We do at the moment have lots of distraction walls being promoted and being helped to develop by the Children's Hospital Appeal, and we still need quite a lot of these, so any funding or anything is really, really good to help us get lots more available for the children to use.
Funds are also needed for keeping Leeds Children's Hospital at the forefront of paediatric medicine. Naveed is seen here using the OR1, state-of-the-art operating equipment which is funded by the appeal. This has multiple functions, including cameras connecting keyhole surgery procedures and also storing images. These can be shared across the world for training purposes. And as Naveed explains here, there's the practical elements.
In the past, when we wanted to do these procedures, we used to get equipment from outside, which used to come on big stacks with wheels and a lot of wires connecting each other. So all of the room used to be full of stacks. Now, you see the floor is empty, there's nothing on the floor. Everything is hanging off the ceiling. So it's helped us a lot.
Hello, my name's Sandra and I'm Sister in Children's Outpatients. We moved into this department April 2011. When we first moved in, all the walls were painted magnolia and they really weren't very child friendly. Since we've had the fundraising and these lovely distraction walls that we've had put up in the department, the difference it's made for the children is absolutely amazing. Before, when the children were being examined, we had to rely on a member of the nursing staff just talking to them to try to distract, or using a book, which is not always easy. If you're trying to hold your child and reassure and trying to balance a book at the same time can be very, very difficult. Having the walls, we can now sit with the child, talk to them and use the walls as a distraction. Not only for painful procedures, but sometimes embarrassing procedures. And it can be something simple as an intimate examination, to a simple dressing or a blood test. But the wall is absolutely wonderful.
I think it'd be good if people helped to fundraise money to get more equipment for the little children, so they've got things to do, because it's the hardest for them, because if 3 or 4 and you're just being brought to a hospital and you're here for ages, you don't know what's going on, you want something to do, you don't want to be stuck in bed if you're not allowed out of bed. And for the old ones, even though like you understand what's going on, you still want something to do, because if you're in isolation and you're stuck in a room, there's just same walls, and you don't want to be looking at them for a couple of weeks, days, months even. You want something just to do, just to keep you occupied.
Everything the appeal funds is over and above the reach of the NHS. Please help us to provide home comforts, distraction toys for children of all ages and create a cheerful environment. And of course, we want to provide our clinicians with the latest equipment. It's only with your help that we can help make a difference to children and their families. Please help us to make a child's stay better, brighter and happier.